still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Homecare is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health.
Hello, South Florida and beyond, and welcome to the How to Stay Healthy show, or Staying Healthy with David DePino. I'm here with Lou Biasi, Vice President of All County Healthcare Incorporated. We're going to get right started. Lou, you're looking great. You're staying healthy.
Well, David, I'm trying to lose some weight. You told me I had to lose weight, so I'm trying. And I'm telling you the same thing. You got to start losing some weight.
I definitely do. You're right. So we don't look like offensive tackles anymore.
I've been looking at all those shows, listening to all these doctors, and they finally convinced me I better get on some kind of diet. And I said, so when I talked to one of the doctors, I said, what's the best diet? He said, just push away from the table. And that's what I've been doing. I've been pushing away and have my meals. So there's no special diet. Just eat less and do a little more exercise.
Well, it's working. I'm glad to see it.
Thank you, David.
Hopefully it'll brush off on me as well. So we have you on the show about every quarter of the year, and I feel like we've talked a lot about COPD. We've had a lot of doctors on the program, nurse practitioners, CEOs, but I wanted to take a little time today to go on another path. I want to talk a little bit about the referral process, home health care, and then get into Medicare Part A. Mm-hmm. So let's talk about, how does the home health care referral process work? Because if you're not involved in it, it's kind of a little tough to understand, right?
Well, number one, health care is very, very difficult to understand for most people. Some people get very confused on what plan they're on or what plan they're not on. This show right now is designed for people that are out there listening. We're trying to help them to decipher, especially seniors. Me being a senior, and I look for the seniors to say, okay, I want the seniors to get as much care as they possibly can, not the amount less care. And what is happening today, everything seems to be going with less care for the seniors, not more care. So, it's sometimes what you have to do, the way the process works, is that, number one, if you're a Medicare recipient or you're a Medicare Advantage recipient, and who's entitled to Medicare? First, let's decide that. If you're over 65 or totally disabled, you're entitled to get Medicare. Now, there's a difference between Medicare and Medicaid, and a lot of people don't know that. Medicaid is a state-issued service. Medicare is a federal-issued service. And Medicare is basically, on Part A and Part B, you have a red, white, and blue card. Don't ever change that card for any other card. The red, white, and blue card is the gold standard in healthcare. When you get sick, that's the card you want if you're a senior. What happens is a lot of these programs, and we're not knocking them, people change, they go on a Medicare Advantage. Now, a Medicare Advantage plan, basically, is supposed to give you the same thing that Medicare gives you as far as home health. But, sounds good, and it should be that way, but sometimes it's not necessarily that way. Because you're looking at basically a Medicare Advantage plan is run by private insurance. Medicare is run by the federal government. Now, if you look at what all these politicians talk about, we're not going to touch your Medicare, we're not going to touch your Social Security. Why? That's what the seniors have been getting since 1963. They've been getting Medicare, and that's something they paid for, and nobody wants to touch that Medicare program or the Social Security program. So all these politicians come in, they reassure you that we're not going to touch it. In the interim, little by little, the government's getting away from Medicare and going into private insurance. They want, one group wants a single payer, another group wants it to go to what we call multiple payers, but basically all private. To answer your question, how do you get a referral for home care? First of all, if you're on Medicare, you have to be what they call a homebound status. That means you have to come through surgery, you have to have a wound care. You have to leave the house. What does homebound status mean? Homebound status means doesn't mean you're bedridden. It means basically that you have to leave home with assistance. Mm-hmm. What assistance means, you might have a home health aide, you might have a cane, you might have a walker, you're entitled to go to your doctor, you're entitled to go shopping, you're entitled to go to your hairdresser. And even George Bush, President Bush, he extended it a few years ago, and he said you can even go to family outings. So home care status is pretty broad. What you can't be doing, you can't be going to a golf course, or you can't be going out every minute of the day and saying I'm entitled to home care. That means you can go out to outpatient to get your care. Home care is basically for those people that are somewhat homebound. They have to be home, they have to only do the chores. Now, how do you get that? Well, the doctor has to sign a prescription for home care, but he has to see you within a certain period of time under Medicare guidelines. I believe it's 30 days after he starts the care, or 60 days previous. And what happens today, Medicare now on the home care agencies is making more and more difficult because we have to have all those progress notes before we can start the care. Now, once that prescription is written, it can be written for physical therapy, it can be written for occupational therapy, skilled nursing. It can be, with skilled nursing, you can have a social worker, and there's many, many things that home care can do. The purpose of the home care was to get you out of the hospital. The hospital cost per day is extraordinary. If you can do the same thing at home in a better environment, because no one wants to be in a hospital. I don't want to be, you don't want to be. I'd rather be home. And statistics prove that if you're at home, you will recover faster and probably healthier. Especially today, there's a lot of hospitals today. You go into surgery, whether it's for hip, knee, whatever that may be, cardiac. The surgery was great, but there's a thing called Mrsa. And a lot of people now are developing this infection called Mrsa. So the whole concept is to get you out of that hospital as fast as we can and make sure you don't go back in. So the referral starts with the doctor saying that you are eligible for home care. I'm going to write a prescription. I'm going to send it to an agency. Now, remember, the doctor may select a certain agency, but it's your choice. It's your choice to whatever agency you want to go to. If you have a favorite agency, you know somebody and you think you want to go to that agency, you tell the doctor, I want to go to that particular agency. And he has to honor your wishes. It's patient's choice, whatever agency you want to go to. Hope you come to our agency. We've been in business for 25 years. So, the name of our agency is All County Healthcare. We sponsor this show. We've sponsored for the last couple of years. Go to our Facebook. You can see all the doctors are on our Facebook. And I can tell you candidly, we do it the old-fashioned way. I mean, we really try to give quality care. The key thing in the way we have increased our business is strictly through quality care. And that's how you get home care. And what's the cost of it? If patients say, well, I don't want it, it's going to cost me too much money. Well, home care is given to you absolutely free under Part A. There's no copay, there's nothing like that. It's given you free under Part A. So if you're entitled to home care and a doctor orders, we get a lot of times a doctor will order home care and the patient refuses, I don't want anybody in my house. Well, guess what? If that doctor ordered that home care, he ordered it for a reason. Now, and he wants to know how you're progressing. Now, once you refuse that home care, it could be a wound, it could be something else. Now, what happens, chances are you're going to be readmitted to the hospital, or the wound can get infected. He ordered that home care for a reason. If he orders home care, please make sure you accept the home care, because that nurse coming in is going to report to that physician to make sure that you're on track for healing. Now, what happens with home care? Home care under Medicare, you can stay on for 60 days. That means you got a 60-day period to stay on home care. Now, in the Medicare Advantage plans, the problem we have there is that the Advantage plans, you manage the AdMeds, the Aetnas of the world, they'll give you a prescription for 2 days. We'll say 2 days worth of home care. Well, there's no way we can cure you in 2 days. So we have to go back and request for another prescription for another week or 2 days. They'll give you another 3 days. Every time that time runs out, the company has to keep getting a new order from the home care. What they call is you got to get prior approval. Just like if you're on managed care and you want to go to get a surgery, your doctor has to order that. The physician, the surgeon is going to do the surgery, he has to get prior approval for the surgery. Medicare, there's no prior approval. You can walk into a surgeon's office, you walk into a cardiologist's office, you walk into a urologist's office, you don't need any prior approval. You just go directly to the physician that you think is where your problem is. If it's cardiac, you go see a cardiologist. If it's a urology, you see a urologist. If it's your eyesight, go see an obstetrician. Go see an eye physician. Whatever that may be, you can go to that physician directly. You don't have to get any prior referrals. Mm-hmm. Okay?
Now, let me ask you this question. So you said it's free if you have the Medicare Part A. Mm-hmm. Well, a lot of people will say, well, Lou, nothing's for free. It's really free. Like the visit to the house is free. There's nothing else attached to that.
If you get Medicare and you get a supplemental,
okay,
it depends on insurance. We don't even touch a supplemental. Medicare, there's two parts of Medicare, Part A and Part B. Part A covers your hospital. Part B covers your physician. When your physician looks at your Medicare, and then you get what you call a supplemental policy. Now, it depends on the supplemental you buy. Some supplementals have a copay. My supplemental that I buy has no copay. So if I go to the doctor from day one, it doesn't cost me 1 single cent for any copay. But I pay the premium that's necessary to allow me to have that policy. Now, home care, remember, home care was given to you in 1963 by President Kennedy and Johnson. It said when you retire, like at the age of 65, or you're totally disabled, you're going to have this insurance in place. David, I go every single day, I get a call from people telling me, Lou, my mother's sick, what should I do? What kind of insurance does she have? I don't know. I think she's on Medicare. What do you mean you think? Go get the policy. Well, I'll look at people who have a tremendous amounts of wealth. They're on managed care. They think they're going to get something, save some money. Well, listen, if you want to stay on the policy that's you've been on for years, you stay on straight Medicare. That's the government policy. That's where they pay the most. So Medicare was given to you in 1963. You still get it today. But guess what? You're paying for your Medicare out of your paycheck. You'll see a Medicare deduction. So you're paying for that. So when you're 65, why do you want to give it up? You paid for it all those years. If you started work at 18 and now you're 65 years of age, or you started work at 20 and you worked for 45 years, why would you want to give something up that you paid for 45 years? Doesn't make sense to me.
Makes a lot of... Yeah, I started working at 8 years old, and I've seen it on there since then. Since I've been working with my uncle back then, and then I worked at a lot of different restaurants, newspapers, etc. I've always seen it there on the pay stub, Medicare. So, like I said, I've paid into it for...
Everybody pays into it.
For the other citizens.
Right. So the factor is, if you've been paying into it all these years, make sure you get it. That's how the referral system works. And if you really don't understand it, call our office at 954-717-7027. You can talk to any of my case managers, or you can ask for me, leave a number, and I'll get back to you the same day. Lou Biasi, just say, I want to speak to Lou. Here's my number. I have a question concerning Medicare. I'll be happy to answer that question.
I know we have a lot of people watch us online or find us online. So also allcountyhealthcare.com, ton of information, great website. There's information on all the services they provide. And then also where we've been a big hit this year is Facebook Live. So just type in All County Healthcare Incorporated to the Facebook Live browser there. We're going to take a quick break, and on the other side I want to ask you a little bit about how can working with home health care be a valuable asset to a physician's practice on the Staying Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Homecare is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life doctors pursue when not providing medicine. And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health.
Hello, South Florida, and welcome back. We're here with Lou Biasi, Vice President, All County Healthcare. That's allcountyhealthcare.com. 954-717-7027, and we'll give out that number and website again before the end of the program. Lou, I wanted to ask you before the break, what are some of the services that seniors are offered in terms of home care? What do you do? What do you offer at All County Healthcare?
That's a very good question. The services that are offered basically anything and everything that they can do in a hospital, with the exception of surgery, etc. For instance, we offer physical therapy. That means if you have a hip replacement or knee replacement, you might go to rehab. Then when the doctor gets you out, he wants to continue that at home, so you continue to have physical therapy at home. He also might have your vitals checked consistently. He might have your blood checked. All this is given and reported to the doctor. Every time we do something with a physician, we have to design a plan of care. The plan of care fits your needs, and it goes along with your doctor's wishes. So we can't do anything without a plan of care. So it's very detailed. Now, why is it so important that, let's say, the doctor wants this? The doctor wants to know how you're progressing. Okay? There's new things coming out, telemedicine, this thing, that thing. Now, physical therapy. Let's say you have a wound, right? And this is one of the things we specialize in. You have a major wound, and you go see a doctor. The doctor looks at that, he sends you to a wound specialist. Podiatry, you could start with a podiatrist, you could start with a wound care physician. He'll say, listen, I want home care for this wound because I want a dressing. I want a 3 times a week dressing, I want a daily dressing, I want a change. He'll recommend certain ointments, he'll recommend certain things for that dressing. We have to comply with his wishes. Now, what happens at that particular time, we take a picture of the wound, we keep it in our file, we send it to the physician, and as the wound is progressing or is getting better, we continuously photo the wound and make sure the doctor knows, and he'll have you back in his office. One other thing we do, every time our nurse goes into a home, and this is one thing I insist on, because I tell you, I'm a senior, and I want the best of care. If I want it, you're going to get it. One thing I insist on is all our nurses do a complete home inspection. Find out where the rugs are. Find out if you need rails. Find out if you need a social worker. They check the refrigerator. They check your medicine cabinet. We make sure you have food. If you don't have food, we want to know why you don't have food in the refrigerator. If your medicine set is full of medication, we want to know why all these medications are there. What are you taking? So we have a list of all your medications. Maybe you're over-medicating yourself. So that's med management. We go into medication management. One of the things we do is say, okay, I get calls periodically. Mr. Biasi, Mrs. So-and-so, there's no food in the refrigerator. Get the refrigerator filled up with food. Get a social worker in there. Find out what's available for that senior. Remember, a lot of seniors are living alone. A lot of seniors are living on strictly Social Security. They don't know whether they're going to take their medication or eat a meal. We want to make sure they take their medication and have good, nourishing meals. You don't have to be ashamed. If you're a senior and you're living on your Social Security, please. There's services out there, and that's one of the things we provide. We provide you a social worker. So if you know a senior that is not getting the right nourishment, or she doesn't have enough money to buy food, call my office. We'll make sure we get somebody out there. We have to make sure that you get what you deserve. So you got wound care, you got physical therapy, we got congestive heart disease. One of the biggest things today is COPD. People are suffering from respiratory disorders, especially in this warm weather. I was out playing golf today, and the heat was getting to me. So respiratory, cardiac, respiratory. Respiratory also leads into cardiac. If you have COPD, we're the only company that can treat COPD effectively. Not only will you nebulize it, we have what we call interpulmonary percussive ventilation system. Very hard to remember, interpulmonary percussive ventilation system. I'm the only company that's purchased these units. These are the same units you get in the hospital. We do it at home. We will keep you out of the hospital. If you go to our website, go to our COPD program, look at it. If you have COPD and the doctor's getting you home with strictly a nebulizer, tell her you want to go to All County Healthcare to try this IPV. And that's what I'm saying. We're there for you. We want to make sure you get the right treatment.
And COPD is very common in the U.S. It's actually now the third largest killer in terms of disease. Like you said, it kind of mirrors congenital heart disease. This is something that Barbara Bush, the former First Lady, had.
If she had our unit in her home, she'd be still living.
Yeah, that's what a lot of people say.
Barbara Bush did not want to keep going back and forth to the hospital for nebulizer treatments. Because what happens, and I'm not a physician, but what happens is the phlegm starts building up into your heart area or into your lungs, and they can't get it out. Well, what happens, they bring you back into the hospital, they put you on a ventilation system, IPV, it's a percussive thing, and it brings it out. And that's why you start feeling better. Your oxygen levels go up. Well, the Medicare pays for an old vest system. Well, it's a heavy thing. It's really, people don't stay compliant. I invested in 5 units. They're $20,000 each. We do not get paid for these units. We get paid for the nursing. I bought these just to make sure the seniors had the best care who had COPD. David, I can tell you, since we've been on the air, these 5 units have been out every single day, all day. People are realizing the benefit they're getting from it. Remember, if you have a respiratory disorder, you have COPD, it might even work in some situations on emphysema, or might even, if you're on oxygen, anything, see if you qualify for the IPV unit, right? Ask your doctor. Call our office. We have a whole pulmonary team started by Ed Salazar. He's been in the business for 40 years as a respiratory therapist. So we've got everything you need for your staying healthy. Our whole goal is to make sure you stay healthy. And our whole concept of us putting the show on was to educate the seniors. When people are telling me, David, they tell me, I don't know. Seniors don't know. There's no one there advocating for seniors. Everybody's advocating for babies or for middle, but there's no one advocating for seniors. It's just like the fact that when Obamacare came out, they're gonna give euthanasia for seniors, right? Seniors have to be educated. If you have any questions and you're a senior, you know your mother or father, and they have to have questions, and you want to have questions, call me. If I don't have the answer, I'll find the answer. Call me at 954-717-7027. This show is healthier to benefit you, the senior. You, the senior, the family members of seniors. One thing I can tell you, I got in this industry, David, many years ago because my dad came down with dementia. Terrible disease. That was many, many years ago. I didn't know very little about dementia. I didn't know what dementia was. And my mom was going crazy, so I basically had to get someone to come in the house to stay with him. We sent a home health aide in to stay with my dad 24 hours a day. That's on a private side. It's called respite custodial care. We also provide those services for you. What happened, I saw the need for this. I was single. I thought, gee, who's going to take care of me? So what happened, I went and bought the company, 3 months later. And it's the best thing I've ever done. It's the most rewarding job I've ever had because I know I'm helping somebody out there staying healthy, getting better, and why do you do it? Right? You either do it because you love it, you do it because you love it. First, you got to love what you do, and I do love this, and I do love what I do, and I love the fact that I'm taking care of people. So, we got 2 minutes. Is that what you're saying? Well, we got 2 minutes left. They're telling me I better keep quiet. So, David, what other questions?
I just want to give out the allcountyhealthcare.com again. There's also an email, info@allcountyhealthcare.com. Lou gave the number. I'll give it again, 954-717-7027. You can see this or any radio show at allcountyhealthcare.com. We've had tons of doctors, probably hundreds in the last 2 years on the program. And lastly, I just wanted to share something about COPD. So it's chronic obstructive pulmonary disease. Did you know Johnny Carson, King Edward VIII of England, and Dean Martin all had COPD? So it's very common. That's what I'm trying to point I'm making.
If most of those guys were smokers, too.
And Lonnie Anderson. I heard something about Burt Reynolds on the way here, and I thought of Lonnie. But, yeah, so COPD, it can really cause a lot of problems.
No matter who you are, it hits everybody. And the other thing, I was going to say one other thing. And primarily, remember, the show is here is to help you. If you're a family member and you have a doctor that you think would like to come on our show, we would love to have him on. Whether he's a physiatrist, podiatrist, family care physician,
internal
medicine, whatever your doctor wants, say, listen, I just listened to the show. I think you should go on it and educate people. The whole concept is, where do you go and what do you do? If you have any questions, again, call me personally, 954-717-7027. Ask for Lou.
And we got about 20 seconds. So Tuesday night, we do the You and Your Doctor show, Living a Longer and Healthier Life. We're having on Dr. David Selzer. He's internal medicine and nephrology. And next Friday at this time, we're having an orthopedic surgeon back on the program. So join us next week. Perfect end.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.